Welcome to Nutrition Rounds with Dr. Danielle Belardo, the podcast for anyone interested in learning about plant-based nutrition through an evidence-based approach. Every week, we share insights and interviews with physicians who are leading experts in nutrition and health. Whether you've been plant-based for many years or are still searching for the perfect diet, Nutrition Rounds will inspire and empower you to live your healthiest life backed by science. Now here's your host, Dr. Danielle Belardo, MD.
Hello. You are with Danielle Belardo, MD, and we are on Nutrition Rounds. So today's episode is highly requested and very special because it's with my friend, Dr. Jackie Busse. So Dr. Busse is a board-certified pediatrician and a national expert in plant-based nutrition for kids and families. She grew up in Madison, Wisconsin, received her undergraduate and medical degrees from the University of Wisconsin-Madison. She went on to do pediatric residency and chief residency at Rush University in Chicago. And shortly after moving to California in 2011, she was introduced to the China study, and it changed her life and her practice. She's been living and teaching a whole food plant-based lifestyle ever since. As a founding member of the Pediatric Work Group of the Plantrician Project, she was the lead author and editor of the Pediatric Quick Start guide. It was published last year and will be speaking at the upcoming International Plant-Based Nutrition and Healthcare Conference. As an expert lecturer for the Colin Campbell Center for Nutrition Studies, she recently rebuilt the pediatric and family lecture modules for the plant-based nutrition certification program offered through eCornell. In addition to her full-time general pediatrics practice in Santa Cruz, California, Dr. Busse teaches an ongoing whole food plant-based nutrition series for patients and has organized and spoken at several physician education events and regularly speaks in local interest groups and schools. She's a member of the American College of Lifestyle Medicine and a fellow of the American Academy of Pediatrics. Most importantly, Dr. Busse is mom to two feisty plant eaters, now 2 and 4 years old. She's passionate about sharing her knowledge, insights, and personal experience with the plant-based lifestyle. I'm so honored to have her here. She's a brilliant physician, and she's really paving the way in pediatrics and plant-based nutrition. I want everyone to know that especially when it comes to pediatrics, I think that people, when it comes to their children, they get very defensive, understandably so, because they want what's best for their kids. So I want to remind everyone listening that Dr. Busse is explaining all of this with regards to overall health for children, but every child is completely individualized, and make sure you talk about any big changes in lifestyle, nutrition with your pediatrician. Dr. Busse does an incredible job bringing the literature and the evidence into this discussion, and I think every single one of you is going to love it. I will be honest, even as an adult practitioner, and I only see adult patients, I was blown away by the data and research she presents about how obesity and nutrition in childhood affects the patients that we see now as adults. It's really remarkable. And I think that even if you aren't involved in pediatrics and even if you don't have kids, this episode is truly worth a listen to. It's really for everyone. It's not just for parents. It's for anyone that needs to learn about nutrition from any level from childhood on, but really for adult practitioners is really eye-opening to realize how much what happens in pediatrics really does carry on to our adult patients and helps shape individuals for the rest of their lives. This episode is especially helpful for parents of children that they're either struggling with picky eaters or they're trying to get their children to go more plant-based and they're nervous about how to do that in a healthful way. And Dr. Busse goes through all of it. So I think you're going to love this episode. And hello, we are here today with Dr. Jackie, and she is here to give you all the information you guys have been asking nonstop about information for pediatrics. And given that this is not my specialty, I am so glad we have Dr. Jackie on today to answer all of your questions about raising a plant-based baby. Hi, Jackie.
Hi. Thank you so much for having me, Danielle.
I'm so excited you're here. So Jackie and I met a while ago at the Plantrician Conference, and I was so excited to meet a plant-based pediatrician, which is also her Instagram handle. I was so excited to meet her because this is a space that's a little touchy, highly controversial. And given that I'm not in pediatrics, I feel like I have no authority to speak on this. And so I really think that this is a helpful topic for us to discuss. There's a lot of confusion out there with regards to diets when it comes to adults. And I think that when it comes to children, people get even more worried and even more nervous to make any lifestyle changes.
Absolutely.
So starting out, first and foremost, let's start with babies. Is it healthy to start out life for your child plant-based with no animal products? And two, how can you do it with regards to formula and transitioning from breastfeeding and everything like that?
Yeah. Well, I think it helps to start out with just the big picture question. Like you said, like, is this okay for kids? And the short answer is yes. It's totally fine. It's safe. It's appropriate. It's healthy. I'm not going to go into the myriad of benefits of a whole food plant-based diet. You've covered that really well with your guests from all different specialties. So for all the reasons that we know that a whole food plant-based diet is the best choice for adults, it's the best choice for kids for the same reasons. You know, there's a common saying in pediatrics that kids are not just little adults. And in a lot of ways, that's true. We can't treat them the same way. The medications are different. The doses are different. They get different diseases. Like, they are different. But at the same time, especially when it comes to nutrition, like, they're just small humans. You know, it's not like this isn't an entirely different species that needs a different energy source. So I think what I always try to reassure people is that it's not complicated. Like, they are humans, they're small humans. They have slightly different nutritional needs, which we can cover those. But big picture, the whole food plant-based diet is the healthiest diet for them for all the same reasons. So that's the first thing I always try to tell people, just reassure, like, you know, you're okay, you can do this. We can talk about the specifics, but
I think that's so important. I'm so glad you actually just clarified that, is because I think even for any of us, so when, you know, most of us, not everyone, but most of us were at some point omnivores, and we grew up with a family that ate meat and animal products. And to make that huge switch for us as an adult was an adult decision that we just made. I think that in general, it's hard to go against the norm. And I think especially with children, people are scared, like you said, that think it's, this entirely different process. And they think that maybe it's only something you can do as an adult. And I love that you explain, especially that you say it's not a different species, because it's so true. It's the same biological processes and everything, and all the benefits, the myriad of benefits that we discussed with adults. So it's just fascinating, because I think that culturally, and we're just raised with one specific way to think that this is the way we should be eating. Dinner has animal products and then maybe grains and vegetables. And I think that because everyone loves their children so much, they just may be scared or intimidated to change that structure that they've seen their whole lives.
Yeah. And I think, I see this hesitation all the time. Like you said, it's hard enough as an adult to make that choice that is going against your family and your friends and maybe what your doctor is saying. But then to impose that choice on a child without their consent or knowledge, you're making this decision for them. There's a whole nother level of sort of parental responsibility and guilt that comes, not guilt so much, but responsibility, I think is the best word, that you're making this choice for someone else. And so I've met lots of adults who are very comfortable with whole food plant-based nutrition for themselves and still hesitate when it comes to their kids, because it feels like such a big choice. And then, on top of that, you have those same family and friends coming back around saying, oh my gosh, is that okay? Maybe you should talk to your pediatrician. And then unfortunately, most of the pediatricians are probably making parents pretty worried as well. So it is really hard. So I totally feel for parents out there who are trying to navigate through, all the contradictory headlines and advice and recommendations from various sources. It's really hard.
It's really hard. So say if, because Natalie Crawford had an episode and she, on the podcast, and she discussed how it's perfectly healthy and very healthy to have a fully plant-based pregnancy. So we went through prenatal, we went through getting pregnant and having a plant-based pregnancy. And now we're going to start with you. So Now, mom and baby, you've had a baby and now you're starting to breastfeed, and say for someone that isn't breastfeeding. So and they wanted to do formula, or they have to do formula for life circumstances or whatever variable it may be. What are their options if they wanted to stay plant-based?
Yeah, so we're jumping to just the biggest question, hands down, is what about the milk, right? And so I think, like, again, we could do a whole hour about how wonderful breastfeeding is and all the benefits that both mom and baby get from breast milk. So assuming that that's the case and that our goal is for all babies to be exclusively breastfed, we know that that's not possible for everybody. So what do? I think the first really important step is make sure that you've really maximized your chances of success for breastfeeding. So many families that, they hit that first roadblock, sometimes even in the first week or so, because it's really, really hard. It's a steep learning curve for mom and baby. And so they hit that early roadblock and, start supplementing because they don't know what else to do. And there's so many resources out there. So if you feel like you aren't getting the support in your pediatrician's office, which is a really good first step, then look out in the community. There are lactation consultants that you can often go make an appointment with, or some of them will even make home visits and come out to your house. There are lots of other community groups for like maternal support groups, breastfeeding support groups, all those sorts of things. There are tons of strategies that we can implement to maximize milk production and delivery to baby. So, getting mom started with a breast pump to increase supply, using, there's something called a nipple shield that you can put right on the breast that can help some babies latch on better. There's so many things that we can try before we have to get to formula. So that would be my first thing, is just like really make sure you've asked those questions and looked for those resources. Okay, so then second choice, which is increasingly becoming an option, but still not available everywhere, which is donated human breast milk. So there are milk banks across the country where women who have extra milk can donate it, and it gets, it's very well screened and pasteurized, and then they sell it. It can be an expensive choice, but the families that I've found have good success with this option is where they just need a little bit extra. Mom is just not quite meeting baby's needs, and so they're able to purchase some donated breast milk to kind of make up the difference. So that's a really interesting and great option too. The third choice, so this is officially not recommended by all the, American Academy of Pediatrics and whatnot. But I think it's worth considering, and that is getting direct human milk donation from friends and family. So this is a little controversial. There are risks. So there's potential exposure to medications that woman might be on, infectious diseases. You don't know exactly how the milk was handled or stored. Like, there's a lot of variables, but I think it can be done well and safely. And it's happening all over the place. And so from a pediatrician's perspective, this feels a lot like the co-sleeping debate. So we know that it's not as safe for babies to sleep in the parent's bed. It can increase their risk for SIDS. And so the official party line is, well, don't co-sleep, to the point where families are scared to tell their pediatricians that they're co-sleeping because they're going to get chastised. When instead we could become having the conversation of, well, how do we co-sleep safely or make it as safe as we can, given that we know that tons and tons of families are doing this. And I feel the same way about milk sharing. It is absolutely happening. I have friends who have done it. And so talking with a mom about well, what questions should you ask? What things do you have to think about? Ideally you would want to know this person really well. So it's certainly not right in every situation, but I think it's something that we should be talking more about. And there are starting to be studies done on this, and how can we best approach it, and how do we best advise women, and how can we make it safer? So I'm totally avoiding your formula question. So
no. That's very good.
Options 1, 2, and 3 are still breast milk.
Yeah.
Okay, so we've exhausted those 3, and now we need to use formula. And so the vast majority of infant formulas are made with cow's milk, and we have tons and tons of data, describing all of the ways that cow's milk is not good for our body. And any pediatrician would tell you to not give a baby whole cow's milk under the age of 1.
Why is that, by the way?
It's really hard to digest. The proteins are. It's really inflammatory to the body. It can cause microhemorrhage in the gut, leading to blood and iron loss. So that's a clear cut, like everybody agrees on that one. What I find really interesting though is that most pediatricians are totally comfortable saying, well, yeah, go ahead and use cow's milk formula or introduce yogurt or cheese or these other cow's milk products in the first year. So the argument is that, they're slightly more processed. The protein content isn't quite as high, but we know that that inflammatory reaction is still there. So I advise all of my patients, all of my families, even, the most staunchly omnivorous ones, to really try to avoid all dairy products in the first year because of what we know about cow's milk.
Interesting. So then how can the effect of cow's milk, just to tangent a little bit, how can the effect of dairy, I've discussed at length of what it does with adults with inflammation. What do you think besides what you just described, what are kind of the effects and the results you're concerned about for being exposed to dairy under the age of 1 in the form of cheese and yogurt? Yeah.
I mean, there's the immediate effects, the stuff that I see in the office that is very clearly linked to early dairy consumption. So things like eczema, that's one of the biggest ones I would say, like infantile atopic dermatitis has a strong link to dairy in particular. We know probably about 30% of it has a food trigger. And dairy is by far the biggest one. And I've seen so many babies have their eczema clear with just removing dairy from the diet. And that's the first recommended dietary change for infantile eczema for everybody, even non-plant-based pediatricians. Like that's what they'll tell you. So there is this acknowledgement that it can cause problems, but it's just not, we haven't quite fully embraced the idea of, well, maybe we should just take it out.
Completely right. You were saying that formula, that's dairy formula, is how do you avoid that then?
Right. So for infants who do need formulas, kind of circling back, I definitely recommend not using a cow's milk based formula. There are some experts in the plant-based world who recommend using one of the extensively hydrolyzed cow's milk formulas. So this is where the protein is broken down into really small protein parts, sometimes all the way down to the level of the amino acid. And so the thought is that isn't recognized by the body as a foreign protein. It doesn't cause the same immune response, but there are other studies that show that it does. So I feel like if we have another option, why are we taking that chance of still causing the same immune response, antibody formation, potential link to autoimmune diseases, all of those things? I would prefer to use a soy-based formula instead.
Fascinating. Is that easy for people to find soy-based formulas?
Yep. It's every single major formula company makes a soy option. It's super easy to find. It's everywhere. It is, officially endorsed by the American Academy of Pediatrics and others as being totally safe and a, nutritionally equivalent alternative to cow's milk based formula for full-term babies. So yeah, that's definitely my strong recommendation would be a soy based formula.
That's great. I think that there is a lot of confusion too with regards to babies and having them when you start to introduce foods, there's concern that they maybe will be underweight if they're plant-based, if they're not eating animal products. Is there anything that a baby needs that has animal products in it? If you are breastfeeding or whether or not you're using formula, when you start to introduce foods, is there anything that we need from meat, from dairy, from animal products in general that we need to have healthy development?
Nope.
I knew that was going to be your answer, but I just wanted to hear it from you.
Yep. So interestingly, plant-based babies really don't look much different than omnivorous babies for quite a while. So, for the first 4 to 6 months, all babies should just be drinking either breast milk or formula. And that's where they get all of their nutrition. They don't need anything else. It's not appropriate to give them anything else. So they're the same. And then when you do first introduce solids, pretty much everybody agrees that, the early first foods should include whole grains and fruits and vegetables. And that's true across the board. The one difference one of the differences is that babies do need to include some iron-rich foods right from the start. So they run out of the iron stores that they've built up during pregnancy around 4 to 6 months, which dovetails perfectly into when they should be starting solid food and getting some nutrition from food. Breast milk is not a good source of iron either. So a lot of omnivorous families will include meat products early on as a way to get in that iron. And so that's the first big difference, is that we're not going to use meat to get iron. We can easily get iron from beans and green vegetables and whole grains. So my favorite first foods are whole grain baby cereals, which if you buy it at the store, those are all iron fortified. So right there, you've got a great source of iron. And then leafy green vegetables, like get in those greens right away. Also a great source of iron. So it can easily be done. And then the dairy differences we kind of talked about, like I really recommend that nobody introduce dairy for the first year. There's no need, and there's pretty good evidence that it can cause trouble.
That's really interesting. I think that there's like such a concern about the weight. Do you find that that is an issue? Do you see that plant-based raised children are of a lower weight? They're not making their goal weight and everything like that when they're developing, or not at all?
It's pretty rare. So it is theoretically possible. And this does get into one of the big differences between adults and kids, is that kids need more energy dense food. So if you look at just, how many kilocalories per kilogram does a person need in a day, a toddler needs about 3 times more calories per kilogram than we do.
Wow.
And so they have a higher energy need. And at the same time, they have small stomachs and short attention spans, and they're burning a ton of energy. So they do need to eat really calorie dense food at every meal. So it's kind of the opposite of how I talk to adults about calorie density, and probably you do as well, is that, we want to focus on like at least half of the plate being low calorie density foods like non-starchy vegetables and fruits and things like that. And so for kids, it's sort of the opposite. Like we still want them to get in those vegetables, but it can't make up the majority of their plate. So their meals need to be based on the other end of the calorie density spectrum. So the whole grains, beans, nuts and seeds, avocados, the healthy fats, that kind of thing. It's very doable, but you can get into trouble if you're eating too many foods on the low calorie density end. And I've seen this, I don't know, maybe 3 times over the last 5 to 7 years, where I actually have had a kid that's eating too many vegetables, that they're not getting in enough calories to stay on their growth curve. So it's pretty rare, but it can happen because, if a whole food plant-based diet is naturally low in fat and very high in fiber, you can fill up fast, which is great for weight maintenance and weight loss as an adult, but it can work against a rapidly growing toddler.
Right. But you're saying it's perfectly safe and very helpful to go whole food plant-based, but just be mindful of the calorie density of what your child's eating.
Totally. It's easy to do, and it's all relative. So the fat differences, it kind of plays into it. You'll see fat requirements for kids anywhere from 35 to 55% of calories should be coming from fat. I think 55 is a little too high, but somewhere around 30-35% of calories should come from fat. And it's not that they absolutely need that fat. I mean, they do, their brains are growing really fast. They are building a lot of myelin. They do need some fat, but as long as they're getting enough calories, they'd probably be okay. But including those higher fat foods is the easiest way to get just up your calorie density and get that in there. So when we think about, if we actually crunch the numbers, which I think is really interesting. So if you have a toddler who, let's say you have a 1.5-year-old who needs about 1,000 calories a day, and you want 35% of those calories to come from fat to make sure that you're getting appropriate energy. So that comes out to about 38 grams of fat. So ideally, that 1.5-year-old would still be breastfeeding. The World Health Organization recommends continued breastfeeding until 2 years old and longer if mom and baby desire. And the natural age of weaning for humans is probably somewhere between 2.5 and 5 years old, which I know is not the cultural norm at all, but that's how we're built. So I'm going to assume that this 1.5-year-old is still breastfeeding, which provides a huge safety net of calories and fat and all sorts of good stuff. So that high fat diet that they need, almost half of it is accounted for just from breast milk. So if you have a kid who's not breastfeeding at 1.5, then it can be really helpful to include a nutrient-rich, higher fat beverage like soy milk to make up that difference, because it can be hard to get in enough calories and fat from food, again, just because of the high fiber foods that we're using and the amount of energy that they need. So for kids over 1 who have weaned off of breast milk, I think including an unsweetened organic soy milk can be a good option. Anyway, so back to our example kid. So they're getting about half of their fat from breast milk or maybe soy milk, and then the other half coming from food. And so if you do breakfast of like oatmeal with some ground flax seeds, and then at lunchtime, maybe some whole wheat pasta with some steamed veggies and tofu and avocado. And at dinner, some other whole grain, maybe barley with like a peanut sauce and some other vegetables and fruits mixed in there. Just from those flax seeds, avocado, tofu, and peanut sauce, you're already getting, that's more grams of fat than he even needs. So it's not like this crazy, super high fat diet that you have to be super, conscious about sneaking in all the time. Like it's a pretty normal diet, and those fat grams and calories add up really quickly. I think the trouble is that, our idea of what a sort of baseline normal diet is pretty skewed. So the average American family is eating 30 to 50% fat. It's not like their child doesn't need any extra fat compared to what the rest of the family is eating. They're already up there. Now, for a family who everyone else is eating, a very naturally low-fat, whole food, plant-based diet, and maybe the adults are only getting between 10 and 15% of their calories from fat, they do need to be a little bit more conscious about adding fat into their child's meal when maybe they wouldn't have put it into theirs.
What about the protein issue? We constantly talk about protein with regards to adults, are constantly asked about protein for people who are athletes, and protein. What about protein with children, with developing children? Is that something you need to worry about? Getting enough protein? Does it happen naturally when you're eating a whole food plant-based diet that's varied, or how does that work?
Yeah, protein is right. This is the most common question I get too. And I will say it is literally the last nutrient that I worry about. And I bet most adult doctors would say the same thing. Well, at least plant-based adult doctors.
Very true.
So I think the numbers are really interesting here too. And again, it's all relative. So it's pretty well agreed upon that adults need about 0.8 grams per kilogram of protein a day. And that is the lowest protein need at any time in our life. So kids do need more. They are growing faster. So protein needs peak in the toddler years at about 1.2 grams per kilogram. So like 50% more. It's quite a bit more. And then again during puberty at about 1.2 grams per kilogram. And the highest protein needs are going to be in our teenage athletes. So they are going through puberty and they're an athlete. They need about 1.5 grams per kilogram. And that's about the same as the numbers I've heard from like high-level adult athletes, about 1.5 grams per kilogram. And so if you just look at that, you're like, wow, they need, almost twice as much. Can they really get that from a plant-based diet? But I would give you the same answer as I would for an athlete, which is they need more of everything. It's not just that they need more protein. They need more calories. They need more fat. They need more micronutrients. They need more of everything. They don't need a different fuel. They just need more of it.
That is so well said. That's such a good point.
So if you switch these numbers from grams per kilogram to percent of calories, which I think is a lot easier for people to grasp, then it looks much more doable. So for adults, we need about 8 to 10% of calories to come from protein, which is what you naturally get on a plant-based diet. For those toddlers and teenagers, the range is maybe like 12 to 13% of calories. And that teenage athletes maybe 14 to 15% of calories, which is still well within what you can easily get on a plant-based diet, and still far less than the average person in the US is already getting. So average US intake is like 15 to 25%. So it's still on the low end of what most people are already eating, and it's still like I said, well within what you can get on a plant-based diet. So those teenage athletes, that's the only group that I do talk specifically about protein, because that's also the group that's most likely to be eating nutrient poor food.
Right, absolutely.
So they can't just eat more like vegan Pop-Tarts and potato chips and think that they're going to get enough protein. So they really do need to think about like those extra calories have to come from beans and whole grains and leafy greens and all that good stuff. But it's totally doable.
That makes perfect sense. And I mean, it's just so interesting about the protein requirement. I didn't realize how much higher it was. And that really is, when you look at the numbers, very attainable. It's not like some astronomical. It's not like they need to be chugging vegan protein supplements. They can do it all from whole foods.
Absolutely. And, comparatively, breast milk is only 6% protein. There's really no other time in our life when we're growing as much tissue, literally building bones and muscles and organs. And we're doing that on only 6% protein.
Wow.
I know. I love that anecdote.
So impressive. Well, what about omegas and people worried about their kids getting enough omega-3s and brain health and all of that?
Yeah. I mean, we definitely know that DHA and omega-3s in general are important for brain growth and cognitive development. And, recently, over the last couple of years, it's been added to infant formulas because we know that breastfed infants are getting it from breast milk. And so, yes, it's important. Yes, they definitely need it. We don't fully know exactly how much and when to start. And the data is kind of fuzzy. Expert recommendations in the field kind of differ. Some say everybody should supplement. Some say only certain groups should supplement. So it's a little bit unclear. I do think that there is reasonably clear data that women who are pregnant or breastfeeding should supplement. Outside of that, we really are not positive whether or not a whole food plant-based child should be supplementing. So what I tell patients is, if you're worried that you're not getting it through diet, so flax seeds, walnuts, hemp seeds, chia seeds, things like that, which can be harder to do in the toddler, young child crowd, then go ahead and supplement. There hasn't been any studies that have shown harm to supplementing, which we can't say for a lot of supplements. So it does seem to be safe. And so I have a lot of parents who kind of choose to err on the side of caution and go ahead and supplement. And I think that's totally fine. The doses, I usually go by the WHO recommendations for kids, which is around like 150 milligrams for toddlers and up to like 200 for an older kid, and then maybe 300 for a teenager or an adult. So not exact. And my own practice has reflected this uncertainty. So I've sort of intermittently supplemented my own kids. Mm-hmm. I was pretty good about supplementing myself through pregnancy and breastfeeding, but the kids, it's sort of been on and off.
Well, then, I'm going to have to ask you the question everyone always has, which is B12. So with regards to B12 supplementation when raising plant-based children, when do we start and how much do kids need for B12? And do they need any other supplements in addition to B12?
Yeah. So just like adults, if you are on a plant-based diet, and really, I think if you're on a meat-free diet, you should definitely be supplementing B12. And I don't think that you can reliably get it from fortified food. So I do recommend, so older kids, adults, absolutely supplement. The question that I usually get is, well, when and how much and that sort of thing. So the first step is to make sure that mom is adequately supplementing through breastfeeding. And so for the first 6 months of life, if mom is adequately supplementing, which is really important, then baby will get plenty through breast milk. And so baby should start taking their own supplements once they are no longer getting the majority of calories from breast milk, which is kind of a gray area. I would say probably around 9 months, and for sure by 1 year if you haven't started already. And as far as how much, we need teeny tiny amounts, just a couple micrograms. I'd have to go back and double check the exact number. I think for infants, it's like half of a microgram, which is ridiculous. So, and you can't find those doses in the store, right? So it's kind of not even helpful to talk about how much we actually need. So I usually talk about like, well, what's a reasonable, like commercially available dose?
Right.
Usually the lowest you can find is 50 or 100. But a lot of times those are in pill form and they can be tricky to give to kids. So what I have found that works really well is that there are some that come in a spray form, liquid form. And the dose is much higher than we need. So the spray that I used for my kids was 500 micrograms. And they would be probably fine to take that just once a week and they'd get enough. But the nice thing about B12 is that it's water soluble. There is no like toxic high dose. We'll just pee out what we don't need.
Right.
You don't have to worry too much about taking in more than you need.
Whenever someone asks about B12 doses, I say the exact same thing. And I say, if you're taking, a large dose, you're just paying for expensive urine.
Yeah, totally. I think that's true for so many supplements that we buy. So yeah, I don't think you have to stress too much about what the dose is. Just find a form that's easy to do for your kid.
The spray is brilliant. The spray is such a good idea.
It's fun. They taste good. The kids love them.
Okay. Well, the question I have to ask is, how'd you get them to be plant eaters? So did they just start straight off the bat? So since they were born, they've been plant-based. How did that work out in your family?
So I feel so lucky to have found this way of eating before I had kids. So my husband and I have been plant-based for about 8 years now. And my oldest daughter is 4.5. So I was fully plant-based even before I got pregnant for the first time. And so both of my kids, my 4.5-year-old daughter and I have a 2.5-year-old son, and they have both been fully plant-based since day one, and they're doing great and they're super good eaters. It makes it really easy when this is all they've ever known.
Right.
They do really well. And so I would strongly encourage families to start as early as possible. It's so much easier than trying to switch the kids over later, for sure.
One thing I hear from moms is that their kids are super picky eaters and that they're super stressed out about just getting them to eat. They're so worried that they're not going to get any food or enough nutrition. And so that's the reason why they've shied away from plant-based nutrition, because they just want them to eat anything. Any tips for that kind of situation?
Oh my gosh, it's so hard. We could do a whole series on picky eating and how to help kids. And there's a lot of parental angst that goes into feeding kids. I mean, it's such a important thing that we do. We are in charge of nourishing another life, and we put a lot of thought and worry into it. So yeah, it can be hard. I think there's a few kind of big overarching principles that are worth mentioning. Getting into the nitty-gritty of it, I would, encourage families to work with their doctor. Again, seek out community resources. There's so much good stuff out there, but a couple big things to think about when you're getting started. One is that the whole family's got to do it. So
I love that.
You can never ask a child to do something differently than you're doing or than the rest of the family's doing.
That's brilliant. Yeah.
And so for a lot of parents, the conversation starts with, well, what are you eating? And having a baby or being pregnant is a big milestone, I think, in parents' lives for them to sort of reassess their own lifestyle habits. What do they want their child to be seeing? What do they want to be modeling in terms of healthy living, healthy eating? So I have a lot of families that are really motivated to change when they first have a baby, and especially when baby's getting ready to start solid food, and they're like, wow, I don't really want to give them what I'm eating right now. So maybe now's a good time to change. And it absolutely is.
That's so interesting. That makes so much sense, because if anyone listening that's still an omnivore, no judgment, I have a lot of empathy toward you. I completely understand. At one point I ate meat too. But if you think about eating, animal products and what we know it does, meat and dairy and processed foods do to our body, it's like the thought of giving that to your child must be self-reflective and kind of give you some food for thought.
Absolutely. Yeah. It's a great time to just sort of recalibrate everything. And kids learn so much from what they see. So eating dinner together, modeling healthy eating, kids always want what somebody else has, right? Like that's just a standard toddler thing. Somebody else has a toy, I want that toy. So if they look at your plate and you have broccoli and kidney beans and brown rice, they're like, oh, that must be the good stuff, right? I want what they're having. So yeah, that's a huge part of it. And then kind of along the same lines is like just taking stock of what's in the house, especially as kids are getting older and gaining more independence around food and in the kitchen and making their own snacks. And you want them to feel empowered to do that, right? You don't want to be policing them. And so the easiest way to not feel like you're policing them and avoid unnecessary battles is just don't keep unhealthy foods in the house. It doesn't mean you can never have, an ice cream treat or whatever it is, but make that a special trip. It doesn't have to be in the house. One of the things we always say is, control what you can and let go with the things you can't. And that's sort of what we've done in our houses. We control what they eat at home, which for most kids, it's like, 80 to 90% of what they're eating. And then when you're out and about, you're at a restaurant, you're at a birthday party, there's a snack brought to school or whatever, don't stress about it. You're providing them with 80 to 90% amazing whole food plant-based nutrition. And you can kind of don't sweat the small stuff.
Yeah, that is actually what people ask often is that their kids, if their kids feel isolated, if they're worried their kids are going to feel isolated at school or on birthdays when snacks are brought in. I grew up in an area in Westchester, New York, where we actually had a lot of people that were Jewish that followed being kosher. And so it wasn't strange to me growing up if someone was abstaining from eating something because of either a cultural practice or something like that. So I never really thought twice about it. So thinking about if I had grown up vegan, I think it would kind of, it wouldn't be so different, but I can imagine in some other areas, people may feel intimidated by standing out by not eating what everyone else is eating.
Yeah. And I do anticipate that that's going to get harder as my kids, transition into elementary school next year. I kind of feel the same way that personally we've been pretty lucky. I live in an area that's pretty health conscious, healthy eating. It's very normal to have friends who are vegetarian and vegan and people eating different things. And so far my kids haven't had any trouble. Mm-hmm. I've actually found the harder part at this age is to help them learn to talk about the way that we eat in a respectful way to their friends. So, on one hand, I would love to just preach to my kids that this is the best and this is the right choice and here's all their reasons, but they are they're little mimics. And so I don't want them to go back to school and make someone else feel bad or somehow, tell them that what they're doing is wrong, even though I know it's not the best choice.
That's a really good point. And that's really important because childhood is hard. And that's a really important point. I think that one of the big parts about being plant-based and going vegan is just overall having compassion. And I think it's important to understand where someone else is in their life and in their process. And I think that's a really valuable lesson to teach your children, because if they learn to come at food from, like you're saying, like a compassionate standpoint, maybe their friends will be like, wow, what is that? That's tofu. That looks really good. And will feel more encouraged to try it, if it's something outside of their norm.
And that's exactly what we've seen. And I had to learn that lesson the hard way myself too, when I first went plant-based and was like, oh my gosh, everyone has to do this. And, I handed out the China study to all of my family and friends and, you kind of want to save everybody.
Right. No, it's true. I know.
But that doesn't come off so well. So much better to just model what you're doing, let them see that you're doing great, that you're getting healthier. And then when they're ready, they'll come ask you. And so we've kind of taken that approach with the kids to like, we're doing our thing. This is the choice that our family has made. And I see that her friends ask her questions and, maybe they are trying things that they wouldn't have before. My kids go to a preschool where they all sit down and eat the same meal together, and peer pressure can be really powerful. So if you're sitting down with a, group of 10 2-year-olds or 3-year-olds and everybody's eating tofu and brown rice and spinach, like you're going to eat tofu and brown rice and spinach. And I've heard from a lot of families that their kids eat better at school than they will at home because that's the norm. That's what they've learned. So yes, it can absolutely be sort of an impetus for change, in your community, in your school, in all those places. But I totally agree, like come at it from a place of compassion and helpfulness instead of preachiness.
Well, I think one of the really important points you just made too is that the peer pressure issue for kids. And we get asked this a lot. And one of the other questions we were asked was with regards to children going to preschool or school in general. If you have a school, what would you recommend for kids that are going to either daycare or preschool that serves animal products and, you're not wanting your children to eat that every single day or at all? What are kind of your tips for that?
Yeah, it's hard. And every school is different. And most schools have a mechanism for you to indicate that your child has a specific dietary need, and they should honor that. Both of my kids, both for daycare and preschool, have gone to schools that work through the federal child nutrition program, which is super interesting. So the schools are required to serve certain foods and a certain makeup of macronutrients, and that has to include dairy and all this stuff. And so if you don't want your kid to have dairy, you have to have a special form filled out by your physician saying that your child cannot have dairy for such and such reason.
This is shocking. So this is absolutely shocking. So wait, so how is that possible?
I know, it's crazy. I mean, the politics and everything behind our food recommendations, including, the women, infant and child. So the WIC program, which provides nutrition for women and small kids who need assistance, the school lunch programs, this federal childhood nutrition program for early childhood education centers. All of it is heavily influenced by industry and politics, and certainly not evidence-based nutrition. That's a whole nother story. But the interesting thing is, so these schools are required to, if they're not providing cow's milk, they're required to provide a nutritionally equivalent beverage. And so as long as you jump through the hoops and get this form signed, they can have soy milk and it's all fine.
Unbelievable that it's mandated the other way around to enforce dairy on children.
It's really, really interesting. And, if you dig through it, cow's milk is the only food that is called out specifically. All the other requirements are for percentage of calories that from protein and fat, and they do talk a little bit about whole grains, but there's no other food that is called out specifically. It's like you have to have all this stuff and you have to have cow's milk. And we've all seen this. You go through the lunch line and it's all this different stuff in a carton of cow's milk every time. Despite the fact, not even touching on all the reasons that we know that cow's milk is not good for us, but just looking at the statistics around lactose intolerance are fascinating, right? So up to something like 75% of the world's population is lactose intolerant. And it's the natural course of human development to become lactose intolerant at some point. So infants are not. It is extremely rare for an infant to be lactose intolerant. They wouldn't have survived, right? Evolutionarily, you have to survive off of your mother's milk, which is a huge percentage of calories come from lactose. So we don't see it in infants, but right around the age of 2 or 3, we start seeing the emergence of lactose intolerance, and the incidence just goes up from there to, up until adulthood where it's 75%, which dovetails in perfectly with the natural age of weaning that the WHO has studied for human breast milk. So once we're done with our mother's milk around the age of 2 or 3, we have no biological need for lactose anymore. And so most of us lose the ability to digest lactose. It's super interesting. I think it's such an interesting example of how our biological needs fit in with a whole food plant-based diet. So even knowing that, we're shoving cow's milk down kids' throats in the lunch line. And I feel like there's some, there's a social injustice piece of this too, because a higher percentage of the kids who are needing food assistance in schools and getting free lunches are minority children, and they have an even higher incidence of lactose intolerance. And so we're giving them this food, we're mandating this food that is not good for their bodies, that could very well be causing them discomfort. in the middle of their school day. And these are the same kids that are, maybe already struggling in school. And it's a really big, complicated
really
problem.
Yeah,
it is.
It's really heartbreaking. It seems really unfair that would be the case. Well, can you actually just delve into dairy, actually, since we've kind of briefly touched over it, but just go more into dairy, and why is dairy specifically? What have you seen from research or just from your own clinical experience besides lactose intolerance? What have you seen dairy, how it's negatively affected children?
Well, the biggest one that I see is constipation. We see constipation is one of the most common causes for a visit to your pediatrician's office, and I see it every single day. And certainly it's not every single kid that dairy is the culprit, but I think it's a huge percentage. So data is pretty clear that constipation is pretty much 100% preventable. There's some rare genetic conditions or anatomical differences that might make up a small percentage, but 99.5% of constipation is preventable with dietary change. And we just don't see it when you're on a whole food plant-based diet, getting massive amounts of fiber. So the kids who are coming in with constipation are inevitably the kids who are not getting enough fiber, which is almost everybody, by the way. I think the statistics of the last NHANES nutritional survey showed that 93% of kids are not eating as many vegetables as they should. And of the vegetables they are eating, it's almost all white potatoes, like French fries, basically. And 60% aren't getting the number of servings of fruit that they should. So pretty much everybody is not getting enough fiber. And then on top of that, the most common kid foods usually include a lot of dairy. And there's good studies linking dairy to constipation. Some really interesting, albeit small, but interesting studies showing that really stubborn constipation that's been difficult to treat. They took a small group of kids and took them off of dairy, and a majority of the constipation completely went away.
Wow.
So that's always my first recommendation. I mean, yes, we talk about the big picture, like eat more fruits and vegetables, drink more water, but really get rid of that dairy. And a lot of constipation some kids it'll go away just by decreasing the dairy, but there are some kids that are really sensitive and would really benefit from going 100% off dairy. So that's one. There's pretty strong links to what we call the atopic diseases. So we already mentioned eczema. The other two in that triad are allergic rhinitis, so like seasonal allergies, hay fever, things like that, and asthma. Also pretty strongly linked to diet. And this is probably some of the most fun patient stories I've seen have been with this stuff, like allergy, asthma, congestion, eczema, that kind of stuff.
Yeah, feel free to share some of them. That's interesting.
Yeah, it is. I see the adult stories can be really powerful. And I teach a class every week to adults learning about whole food plant-based nutrition. And we see these dramatic changes that you probably see too, like coming off of statins and coming off of blood pressure medicine and chronic pain going away and crazy stuff. What I found for kids is that it's often more subtle. So they don't have these big, scary diseases yet. They will if they keep going, but it's the little stuff. So I saw, I think this little guy was maybe 6 years old, and he's not someone who would stand out in my mind as a sick kid. He wasn't coming in a lot. He's, growing, developing normally, but he just had this chronic low-level congestion and mild allergies and some asthma, nothing terrible. And the whole family went plant-based. It was him and his older sister and their mom and dad. And they came back maybe 6 months later, and mom was tearful because she said his congestion's gone, his allergies are gone. And we thought that was just him. All these years, oh, yep, that's just how he is. There's nothing we can do. And to see that go away, even though, he wasn't, like I said, he wasn't that bad, but to see that go away just from the changing the diet was really emotional for her. So it's things like that. I had another, she's a little older, maybe 8 or 9 year old little girl who had chronic abdominal pain and constipation to the point where she was having a lot of anxiety in the morning, going to school. She didn't want to have to use the bathroom at school. She knew it would hurt. She was crying in the morning. She was late for school almost every day. And I talked to them and really strongly encouraged them to at least make some change towards a plant-based diet, if not give up dairy completely. And then I didn't see them for 2 years. I think their insurance changed or something. And then when she came back, she seemed happy, and they weren't bringing up any of these things. And I finally asked, I was like, hey, how are you doing with your abdominal pain? And they both just sort of, her and mom both just sort of laughed. She's like, oh my gosh, I totally forgot about it. It's gone. She's like a new person. I was like, what did you do? They had dramatically decreased their meat intake. They weren't completely off of meat, but they were almost 100% off of dairy. And she's like, yep, it totally made the difference. She's like a new person. She's happy in the morning. She's pooping regularly. She's going to school. It totally makes a difference. And all of this common stuff that we see. Recurrent ear infections, sinus infections. I mean, it's a pretty long list.
So what would you say? A lot of people ask, I mean, let me just actually go back and just say that's so moving. That's really incredible, because especially when you're developing and, even having something that may seem minimal as constant rhinorrhea and a little bit of asthma, that's still life-changing to have that improve with a lifestyle modification and not a medication. So what do you think about childhood obesity and how, it's just this massive epidemic, and we have plenty of processed foods to blame. And I think dairy is a huge culprit, as well as, of course, animal products. And how do you think that this should be addressed? It's really just these children that struggle with childhood obesity become my patients when they're adults. So it's really, it's truly an epidemic.
Absolutely. And I think, it is at the heart of every single thing we talk about. So everything that you're talking about in cardiology, trying to prevent heart disease. We hear that upwards of 70 to 80% of cancers are preventable. Diabetes is preventable. All this stuff is preventable. But yet I don't hear a lot of talk about how that relates to childhood, despite the fact that all of these problems start in childhood.
Right.
So I think if we're really serious about actually preventing these, like primary prevention, like getting to them before they even start, we have to be talking more about whole food plant-based nutrition starting right away in infancy. And obesity is no different. So childhood obesity, we don't have to hammer it home. I think everybody's aware of this, but something like, I think 30% of kids are either overweight or obese. And that, obviously it has a lot of short-term effects. Being overweight is related to all sorts of problems in childhood, including a lot of the stuff we've mentioned. There are social implications. It affects childhood for sure, but then also just super interesting studies on how being overweight as a child affects your adult health. So obese kids are very likely to become obese adults. And, with that, all of the risks associated with increased rates of heart disease and diabetes and cancer. And even if an obese child loses the weight as an adult, that risk doesn't completely go away, which is a little bit scary. So there was a study, where was that? I think it was in the New England Journal in the 90s, that they followed these obese teenagers through their adult life. And the teenagers who were obese, who lost the weight later, so they were a normal weight as adults, they still had double the rate of death from heart disease and I think cancer too, than their peers did when they were in their 60s and 70s.
Wow.
And we see there's other studies showing similar results for cancer. There's something really powerful about being overweight while you're growing. So for breast cancer, for example, we've known for a long time that adult weight is important, that women who are overweight are at higher risk of breast cancer. But what it seems like is that being overweight as a teenager during puberty, when the breast tissue is developing, is even more strongly linked to your risk of cancer than your adult weight is.
Wow.
Yeah.
That is mind-blowing.
Obese kids are also more likely to go through puberty younger. Earlier puberty is associated with increased rates of breast cancer, ovarian cancer, prostate cancer for guys. That's a huge kind of underlying risk that links some of this stuff to. Ovarian cancer, weight during even the first couple of years of life is implicated, which then has implications for maternal health and diet and weight, because our weight as an infant is partially due to mom's weight during pregnancy and her insulin levels and things like that. So being heavier and taller in childhood increases your risk of ovarian cancer by like 50, 60% as well. Same thing with colon cancer. Teenage weight is super important. So if we take all of the cancer studies and just kind of lump them together, here's the trends. Your risk of having cancer as an adult goes up if you eat less fruit as a child, more meat, and the earlier you start eating meat, the worse it is. If you're overweight as a child, if you grow quickly as a child, just like overall increased calorie consumption in childhood is linked to, what are the numbers on this one? Sorry, I'm kind of pulling up the studies as we're talking.
Oh, that's okay. This is really interesting.
So for every additional 238 kilocalories consumed in childhood, there was a 20% higher increased risk of death from all cancers combined.
Wow.
So all of this, like you mentioned earlier, there's a lot of worry around, are kids going to grow? So the question is always, are they going to grow well? And if you distill that down into like, what does that mean in American culture? It means we want them to grow fast and big.
Yeah.
that we've sort of decided that is good. And I see this in clinic all the time. If kids are even below average on their growth charts, parents are worried. Half of us are below average by definition. It's normal. Bigger is better, right? You want the super chubby baby, you want the tall, strong boy, but yet consistently across animal studies, human studies, fast growth in youth is not good for us. It is associated with increased all-cause mortality, shorter lifespan, all of these things. So when we look at the overall evidence on how vegan kids grow, they do tend to grow a little bit slower. They tend to go through puberty later, both of which are really good things.
Right.
So it's kind of the opposite of what we think we should want.
This is just the cancer statistics are mind blowing. So the only part with regards that I had known prior to this, that I had known from cardiovascular research, is that there was one great study where they had done children who had died of other reasons under the age of 20. They'd done autopsies and found in children that were literally even infants, they found the beginning of atherosclerotic plaque and fatty streaks in their arteries. And they've even been able to find it in utero, knowing that coronary artery disease can start to develop, atherosclerosis can start to develop at a very young age. And it's just interesting that these building blocks of, unhealthy living, and that these building blocks of disease can start so young, even spread so far as cancer and all different kinds of cancer. It's really interesting.
Yeah, it really does start young. And yeah, those autopsy studies were pretty eye-opening when I first saw them too. So you're exactly right. They've seen the fatty streaks, so that, the very earliest stages of atherosclerosis in kids as young as 3 years old. And by 10 years old, if you continue on, sort of a standard American diet, pretty much 100% of kids will have those fatty streaks.
Unbelievable.
And then, as you know better, like by your 20s, they're developing into plaques. And then by their 50 or 60 years old, you're seeing them in your clinic. So yeah, I forget who always says it. If it's Dr. Esselstyn always says it's not about, for the average American, it's not about preventing heart disease. You have to assume that you already have heart disease.
Absolutely. Yeah.
Even if you're, 10 years old.
That's why I completely agree. And I think that is more kind of well known. And I guess at least heart disease is more with regards to obesity. There's more of that link. But the statistics you gave about cancer and obesity in childhood are literally mind blowing. And there's got to be some infiltration. This has to be into the American Academy of Pediatrics. Like, how has this not changed your dietary guidelines?
Right. This is the question that every specialist gets is like, why isn't everyone in your specialty like shouting this from the rafters?
Yeah.
And, I think the answer is the same for everybody, which is it is slowly changing. Things are better now than they were 20 years ago. So at least now we have sort of official position statements that say that a vegan diet is okay. And they always kind of couch it as like a well-planned, appropriate, add a couple more adjectives, vegan diet is okay. So yeah, I mean, we're making slow progress.
So what do you recommend for parents? And I actually hear this all of the time. What do you recommend for parents who are seeing a pediatrician who is against going on a vegan diet, that is very, very intimidated by it, and either your child already is vegan or you were thinking about having them transition to a plant-based diet? What is the best way for a non-medical parent to, respectfully, but get their pediatrician on board with this?
Yeah. So I think if you're to the point where you're feeling uncomfortable or unsupported, then it might be time to find somebody else.
That makes sense.
But I think for most people, if you have a good working relationship with your primary care provider, they should be willing to have that conversation. And they may not be 100% comfortable with it, but they should be able to see that, okay, you're meeting all of your developmental milestones, you are tracking well on your growth chart. They might want to do some labs, which is not necessary, but reasonable. So I would just bring it back to that. Like, look, my child's doing really well. I don't have any concerns about their health or growth or development. And so I think a good doctor should be able to step back, even if they personally wouldn't recommend it, and say like, okay, as long as you're doing okay, then I can support you in this. Here's a couple things to think about.
I ask that question as well to like every specialist. And the thing I've discussed at length too is that, everyone kind of has a similar answer. And I guess the issue I think that everyone can agree on is that, we have so much literature and data to show us in every single subspecialty at this point. If you have listened to this podcast, you've heard every different kind of specialty explain to you how disease processes in their patient population can improve with plant-based nutrition. The only reason I can see doctors not recommending it is because they are disconnected with I've mentioned it before, there's this cognitive dissonance where they don't necessarily want to recommend something that they're not doing themselves, and they almost get defensive. I think that it's important for medical providers to understand that it's okay if they don't want to go vegan. That is okay. That is completely up to them. And I respect it. I really do. I respect everyone to be able to make their own decisions. But that being said, that shouldn't change the way patients are counseled. We can't, say that eating meat makes you live longer when we know that there's no data or evidence to show us that. So even if you yourself can't make the change, providers need to be open to their health conscious patients doing so, and they need to be supportive of it.
Yeah. And I think you can take it back to maybe ask them what they're specifically worried about, right? So if you are not eating meat and your provider is worried about you not eating meat, it's like, well, what are they really worried about? Is it the iron? Is it the protein? And so you can answer those specific questions a little bit more matter-of-factly and objectively.
Actually, what they can do now is everyone out there listening, if you have a pediatrician that doesn't agree with plant-based nutrition, you can just refer them to this episode.
There you go. Just have them listen. But I think that can be helpful. And for pediatrics, I think milk is really the big elephant in the room.
For sure.
Most people are comfortable with vegetarian diets, but when you talk about taking dairy away from kids, it does get a lot of people nervous. But if you step back and it's like, okay, well, what are we really worried about? Admittedly, dairy is an easy way for kids to get in a lot of calories, a lot of fat, a lot of calcium, and vitamin D. And that's it. Those are usually the 4 things that are brought up by pediatricians and pediatricians that have challenged me too. Like, well, where are you going to get these things? Those are the things that they're worried about. So we've answered the calorie and the fat question. You can easily get enough. And I would argue that cow's milk has too much. It's a very energy dense food that most kids above the age of 2 or 3 have absolutely no need for. Vitamin D is added artificially. It has nothing to do with dairy. So that's sort of a non-starter. And then the calcium question. This is kind of a big topic. I think the research around calcium is really interesting. But my takeaway is that the evidence that dietary calcium is the most important thing when it comes to bone health is pretty weak. So we see populations around the world who are eating far less calcium than us, sometimes like a third as much calcium as us, and they don't have any increased rates of osteoporosis or fracture rate. And there's plenty of kids who are either lactose intolerant or have a milk protein allergy, and adults who are not drinking dairy, and they don't seem to have worse bones. It's usually the opposite, actually. Countries with the highest dairy intake have the highest rates of osteoporosis and fractures. So the way that we understand dietary calcium and bone health, I think, is a little bit more nuanced than what we've been told. When it comes to kids, I think the more important factor for bone health is weight-bearing exercise. And that's actually true for adults too. So most of our bone density is laid down by the time we're 20. So people are right to be conscious about bone health in childhood, because that's when we are building our bones, and we want that to be a healthy period of bone growth. But it seems like that weight-bearing exercise is probably the most important thing. Getting enough vitamin D is definitely important. And then other dietary factors like eating a low sodium diet, eating a diet that's high in antioxidants and less acidic can be really good for bone health. So there's lots of things that sort of point towards a plant-based diet without specifically saying it. There definitely is like a minimum dietary calcium intake that we all need. I suspect it's a lot lower than what our RDAs are set at right now. So we don't know exactly what that number is for kids, but I think as long as you are purposely including some calcium-rich foods, which again, the beans and greens are like your powerhouses.
Right.
And some of the nuts and seeds too are really good. So include those calcium-rich foods, make sure they're getting exercise, make sure they're getting vitamin D, and eat lots of fruits and vegetables, and I think they're fine.
Perfect.
And there's nothing else in cow's milk, right? There's nothing else good in there that we can't get somewhere else.
Absolutely. And there's just all of the reasons that any of its benefits are so outweighed by its risks from all of the pro-inflammatory and negative effects of casein and lactose intolerance and everything.
Yep.
Well, thank you so much. I feel like we covered absolutely everything pertinent. I just wanted to see if there was anything else last you wanted to add in that you think may be important for the listeners.
Yeah, I think we hit on all the big things. Yeah, I think the takeaway is just where we started, right? Like a whole food plant-based diet is not only okay for kids, it gives them such an amazing foundation for lifelong health. And I think, as we mentioned with, heart disease starting really early and the cancer risk starting early, like those first couple of years are really, really important. And the good news is that those are the years where we have control. We have pretty much 100% control over what our kids are eating in the first 2 to 3 years. And I think it's worth being kind of militant about it.
Yeah.
Those first couple of years. And then, we'll cross the bridge when we get to elementary school. But I always take heart in the fact that I got in a solid 3 to 4 years of amazing nutrition. And even if they move out of the house and decide to be a carnivore, at least I've done the best that I can.
Foundation is
give
there.
them the best start that I can.
Absolutely. And the foundation is there. And I think that that's what's important. And I'm really glad that you were able to clear up. There's just a lot of misconception and fear in the nutrition area for new moms and new dads and for children. Yeah. And I think that you really helped to alleviate a lot of concerns. So where can everyone find you?
So I think you mentioned Plant-Based Pediatrician on Instagram and Facebook. And I have a website that's also www.plantbasedpediatrician.com. So yeah, those are the places.
And what if someone wants to come see you as a patient?
So feel free to email and we can see if we can figure it out. My majority of my life is in like a normal private practice. So all of the annoying insurance regulations and things like that come with it. But I'm happy to talk with people and see if that can work out. But oftentimes we just sort of end up answering questions over email and things like that.
Great. Well, thank you so much, Jackie. This was enlightening and absolutely interesting and filled with so much information. I feel like I've now brushed up on my pediatrics, and thank you for that.
Well, thank you. And I mean, thank you for this podcast and all of the work that you do. And thank you for kind of shining a light on the pediatric end of things too, which I think is just
highly requested.
Awesome.
Everyone's been asking. It is like the question everyone had was how to do this with children. So you really, I
hope everybody feels a little bit more comfortable, and
you absolutely. It's fantastic. So thank you so much.
Thank you, Danielle. It was a pleasure.